Daniel Fewster and his family are lobbying to create a new law called Debbie's Law. Debbie was Daniel's mom. Unfortunately, in 2024, she passed away after sitting on a wait list for life-saving heart surgery. Daniel, can you tell us first a little bit about who your mom was and what kind of person Debbie was?
Yeah, my mom was an absolutely wonderful person. She was very close to my family. We had a really good relationship. She had a really good relationship with my kids. You know, she was basically a third parent to my children in terms of closeness and availability. Very, very involved member of the community. She loved helping people. And I'm not just saying that because she's gone and you try to, make people seem better. Like, she really was. She worked for Samaritan's Purse doing disaster relief cleanup. She went out west to the fires in BC. She went out east when there was hurricane damage. She had just received training to be a leader for the teams in those areas and being involved there. So loved to serve, loved the outdoors, loved to tackle and garden and build her own little yard up in the ways she could. She was an absolutely phenomenal mom and a fairy tale grandmother.
So tell us a bit about her health issues. What did they start to notice? When was that? And
Yeah.
What went wrong then?
So it did go quickly. My mother had symptoms of what we came to know was angina. And I guess the doctors had indicated that in women oftentimes angina presents as like heartburn. So April, May, my mom had been having these symptoms, and at first we thought it was heartburn stuff, but then we said, Mom, you should get this checked out. It's a little more intense than just what heartburn is. And so she saw her doctor, and he did whatever kind of tests he does and determined, yeah, this is not heartburn, this is angina, and we need to get you to a specialist immediately. So he fast-tracked her. That was in early to mid-July. Fast-tracked her to a specialist, a cardiac specialist, who did a stress test for her on August 1st. He was actually booking into December just for the meetings and consults.
Wow.
And so we were thrilled. She's getting fast-tracked. This is urgent. They know it's urgent. Even the specialist is like, okay, I see this is serious. Let's get her in. They did the stress test. Normally it's between a 5 to 20-minute test. She failed within 3 minutes. So it was they were completely aware of how urgent it was. And next step was, well, the doctor or the specialist told her, you need to pack your bags. You need to have a day bag ready to go because you need a surgery within 3 weeks. This needs to happen ASAP. He said, I'm going to fast track you to an echocardiogram to determine exactly what needs to be done, but pack a bag because this surgery needs to happen any day. So we were ready. We were thrilled. We felt like, man, the healthcare system's on it. They're pushing things, and they absolutely were. So echocardiogram came 22 days later. She had that done. That's where they determined the extent of the damage. So she required a triple bypass. And this whole time, like my mom, she's a breast cancer survivor as well.
Oh wow.
Yeah, early 2000s. She had went through surgery for some breast cancer tissue and lymph node stuff. And so she'd dealt with the healthcare system before. And they'd shown up for her in that area. And so we kind of just felt, okay, like it'll be the same here. We'll see a speedy resolution to this, and we'll get her the surgery, and we'll work on recovery with her. But after the echocardiogram, that's kind of where things went stone silent. And my mom's not a pushy person, nor did we feel we should be in our healthcare system. We didn't understand that you kind of have to elbow your way in.
So when you say stone silent, like you just stopped hearing from people, no more updates, all of a sudden you tried, or did she try reaching out? Or like you said, you're trying not to be pushy and you're like, okay, they're on it. We'll hear when we hear. It's okay. If they're quiet, then obviously it's okay right now.
Yeah, hindsight's 20/20, right?
Yeah.
Like we did feel that way. Oh, they've rushed her this far. They must be on it. My mom did receive a phone call on September 4th And the pre-op nurse told her that basically you were going to be scheduled in September. Now it's pushed off to October, hopefully. And the reason the pre-op nurse stated, was because they were catching up from staff holidays over the summertime. And so disappointing. But we, just looking back, we probably still didn't sense the urgency that was really at stake here. And we did still have a trust in the system that they were going to get to her in time. And that's when it was quiet until like nothing, not her doctor, not a specialist, not the St. Boniface team, nothing. There was no contact until, we just never had contact. She passed away on October 13th.
Had her health started noticeably declining before her death there? And what happened then? Like nothing still happened?
Well, like I said, it was rapid.
Yeah.
In April, she had been hiking for 2 hours a day in the mountains with my sister who lives in BC. By August, she couldn't hardly walk 100 meters without having to stop and catch her breath. So, and it seemed the hospital, or at least the specialist, was aware of that, as they had fast-tracked her up until that point. But from when she was diagnosed to when she was passed was over 60 days. And according to the government of Manitoba's website, the wait times, I think in December, were up to 10 to 12 days. And if it was secondary urgent, it was like 27 days. And if it was third, it was basically elective. So up to 130 days. So having failed the stress test and gone through all that stuff and the urgency, I don't know where they placed her. I don't know if she knew where they placed her. But it could have been 10 to 12 days. And she waited well over 60. And they knew how urgent it was. So her passing was an absolute shock to our family. She had medication, anti-heart attack meds, anti-stroke meds that were carrying her. But if we'd have known that it was, she never got a date. We never got one. If we'd have known, we'd have made other options. We'd have liked to have been aware of that so that we could go to a different province or inquire about it at least. Would we seek private health care? Maybe. We'd have pulled all the strings. There's GoFundMes. There's remortgaging your house. There's options to get a hold of money if it was something that we knew we should have done.
So, like I said, you and your family and her friends, you've been campaigning and lobbying now for something called Debbie's Law. Tell us a bit about what you hope Debbie's Law will be and what that would look like.
So Debbie's Law would require healthcare regions to immediately inform patients of life-saving treatment. So stuff like heart surgery, cancer care, stuff like that. If it can't be provided within the recommended time, and even suggest they seek care elsewhere or make them available options. And this would basically give families options. It actually would reduce wait time lists. If people had more options, they could go to other places, and the wait list would actually benefit from that,
So as far as you know, it's not a requirement right now then for health professionals to let a patient know, like, hey, we're probably not going to be able to help you in time here. You probably, if you can, look at other avenues. That's not a requirement right now by law.
As far as I know, it is not a requirement. Wow. And this is not something that doctors are unaware of either. We've had many people reach out to us. That we've heard many stories of individuals who have been told by their doctor, you need to seek care elsewhere because this ain't going to work in the time period we need it. We have people in BC who have already been sent to the States at the recommendation of their doctor to receive life-saving cancer treatment because the system in Canada can't get to them in time.
How's that make you feel, like that our system can't get to people in time, and now experiencing a tragedy like this? Like, I don't know, healthcare is hard to perfect, right? You look all around the world at the different ways it's done, and it's like, oh, there's probably no perfect way to do it, but we can't even get to people in time after months and months of waiting. What's that make you and your family feel like?
It feels like it feels like a failure. It feels, in a way, almost being taken advantage of, because we pay all this money into the system that we're told is going to be there for us. and when we need it, it wasn't there. That does not feel good. And it's not like there's other options available in Canada. We trusted this system, but that's part of where Debbie's Law comes in. You know, we want people to get honest conversations from their doctor about wait times and if they'll be able to get to them. And we also want to make sure that these kind of stats are being recorded, because that's the other part that's kind of concerning, is that most healthcare regions don't have a steady record of if people are dying on wait lists.
Wow, really?
Yes. The organization we're working with, Second Street, they actually had to do freedom of information requests, and they usually had to pay money, usually between $600 to $1,000, to get access to that information. The information was either non-existent or very sporadic and really not worth a dime in terms of data collection.
Yeah. Yeah, you're not getting enough actual of the data to know then.
Yeah, and if we can't track the problems with the healthcare system, how can we improve the healthcare system? So that's the second thing that Debbie's Law tries to address, is we need better record keeping. We need to know if people are dying on these wait lists. We need to know how many. We need to know why. And we need people to know that if they can't get to them in time, they need to seek help elsewhere.
Have you mentioned, like, you just heard from the hospital or health authorities about, like, well, it was vacation time and they're catching up. But, like, have you heard, like, from health authorities or politicians, like, have they reached out to you, any apologies or things like that, since your family's taken the story and Debbie's Law public?
So since we've taken the story public, yes, we've heard from healthcare authorities. We've heard from the health minister. We've heard from the critic on the opposition. We've heard from St. Boniface Hospital and the WRHA on these issues, offering their condolences. To my understanding, they are doing an investigation into what exactly happened. And so, yes, they've reached out since the press conference, once it got some more attention. And so that's been good. I'm really excited to work with the government on these issues, if they're willing to work with us, you know, and it seems they are. I had a very good conversation with the health minister, and the minister was very clear. Minister wants to meet with us. We'll plan going forward. We'll talk about the policies and what we think Debbie's Law could look like one day. So that's been encouraging. I know there's a lot of families who have faced the same thing we have, who have not had that option or that kind of grace extended to them. So we really do feel like we're representing a lot of people who have bumped into and been failed by the system. And the amount of stories I'm getting of people reaching out to me is phenomenal and heartbreaking at the same time.
Yeah, right? I was just say, like, it's great in ways, but kind of a heavy weight, I guess, too. You guys have to carry, like, oh, we're doing this not just for mom, but all these other families. And maybe the good to come out of this is maybe your family will help prevent other deaths in the future now then, right?
That is the ultimate goal. This has been one of the most painful seasons of my life, and I've been through some stuff before. The ultimate goal of Debbie's Law is to prevent other families from having to walk down this road if we can. And it's not unreasonable. It's not partisan. It's we want our healthcare system issues to be resolved so that everybody can benefit. And that's the ultimate goal of Debbie's Law, is to stop other people from going through the pain we've had to.
What can we do? People listening and they're like, yeah, this needs to be a law. How can people get involved? How can we help make this a reality?
One of the most practical ways you can make this a reality is to write an email or a call the health minister's office and just inform them that we support Debbie's Law. We want this. This is important to us. When politicians hear from their constituents, from people in the province, that they want something, things change.
Yeah, it does matter, right? It carries weight, actually. Yeah.
It does, and they listen. And so that would be the first one. The second point would be, if you're going through this kind of thing yourself, talk to your doctor about it. Ask them to be honest with you about wait times, because, we had to learn the hard way that you do have to be a little bit pushy.
Yeah, you really do have to advocate for yourself. I was told that once when our family was going through some really tough stuff in the health, and it kind of made me angry. It's like, why do we have to advocate? But I understand too, at the same time, the system is overwhelmed, right? And understaffed likely. And but you have to be pushy, right?
And our doctors and nurses are doing the best they can.
Yeah.
They're working so hard. They're all overworked. I hope people understand that. This is not about pegging some doctor to a wall. Like, we understand. I have friends in the healthcare system. I have friends in the fire department, the paramedic, the ER, all the way up. My sister-in-law is a RN. So this is not something we're trying to pin on the healthcare community. But we do recognize this is a system problem. That's also what people within the system have said to us. It's a system problem, and it needs to be addressed.
How can we pray for you, people listening? How can we pray for your family?
I guess just pray for our hearts and that we would be comforted. It's hard. It's hard for my kids. It's hard for me. Grief is a journey, and it's weird and painful and on a lot of different levels. And so pray for my family for peace, but also pray that Debbie's Law would come to pass, because it really has life-saving potential. It may help your family one day.
Yeah, right. It's powerful.
Yeah.
Do you have a website or anything like that? Or
you can go to secondstreet.org.
Okay.
That's the organization that's helped us rally this. They're the ones who did the video recording. They're the ones who have proposed the legislation and helped us build it. And they'll have all the information you need on their website, secondstreet.org.
We'll check that out. We'll pray for you and your family. And everybody listening, you can write your MLAs, write your MPs even too, right? Like, healthcare is a provincial thing, but MPs carry weight too, and they need to be involved and know, I think, that we need systematic change. So,
Absolutely.
Anything else that we missed that you want to touch on, Daniel?
No, I think that's it. Thank you for taking the time for covering this, for bringing exposure to it. That's a huge win for us, because this is something that's just not being talked about enough publicly. Yeah. So thank you for taking this story on, and for CHVN for helping us put it out there. Well,
and thanks to you and your family for being willing to do this publicly, right? And in the midst of your own grief, to fight for other families out there too. It's powerful work you guys are doing. It's important. Thanks.
Thank you.